Hi, this is Don Hughes, and here we are with another short video from COGTRIUM on how and why we should be using telehealth and how we can enhance our practices with it. One of the single biggest benefits of a COGTRIUM membership is that you have access to telehealth. And it's not just to the patients that COGTRIUM brings to you to use the telehealth system with, but it's for all of your patients, all of your existing, and you're encouraged because the better you get at telehealth, the better your treatment modalities and the more effective your outcomes. And that's appreciated all the way around. The thing about telehealth, is the question I'm always getting is, can we really use it? Are there really settings and opportunities to do it? It's fairly obvious in many of the interpersonal counseling sorts of settings. Family counselors and those dealing with individual problems, depression, anxiety, and those kind of things. The experience for the patient and the provider are often very, very similar online as they are in the office. There are differences though, and you should be aware of those. A lot of people, based on your individual preferences, are gearing off of cues, physical cues, and other things that you're seeing in the person sitting across from you. Oftentimes, these are enhanced online, and sometimes ones that you've been relying on aren't as obvious. So there are some adjustments. They're minor, and with practice, you'll hone your techniques very quickly. In a lot of the others, where cognitive behavioral sorts of information is being used and treated, it can be different. Some examples like speech therapy, OT, many of the autism sorts of modalities. And we need to talk about those. There's a lot of resources on our website under the tips and tricks and frequently asked questions sections of the support. You should read through those as you get special questions. But if you think of what the differences are, what we're really looking at is the difference between having a person in the office with you and having them online. With a child, that can be a difference. If your therapy is really upbeat, a lot of positive reinforcement, a good example, speaking with one speech language pathologist, an SLP, who's very, very vibrant and touchy-feely, and dealing with kids online, it becomes how do I make those adjustments so I still have it? So it comes down to how do I get that same great interaction that's going on. She uses high fives, like got to give a high five when I have a success. Well, online, that means you got to teach the child how to give high fives. It's probably not just slap the camera, but it probably is the big wind up and then give the high five. If you're going to do a hug as part of the big reinforcement, probably can't be just hug the camera. It's got to be something that we have finger wiggles and then we do the hug. It's being creative. It's feeling how your personality works, how your reinforcement schedule works, how those things work for you. But getting on and trying it, you'll find those through. A lot of speech therapy modalities are involved in drill sorts of things, whether they're cycle or phonetic or any of those standard sorts of protocols. A lot of those will have flashcard type things that are being used. They're asking for a response from the child. There's a number of ways to do that. The COGTRIUM platform has an ability to upload your materials and then be able to sort through them so they're showing up on screen with the patient. A lot of SLPs are finding though that rather than do that, they get more interaction and more positive feedback going on if they actually just use their flashcards. By holding the flashcard up and going through them, it can get much more of an interactive and much more of a body language sort of payoff. One of the things is you hold it up sideways and ask the kid if it's sideways. Make them learn to say sideways and then upside down or right side up. But it can become its own method of inclusion in it. But those are all personal preference and how you do it, how you get the best results, and how your patients react to it. And it is experimenting. It's one reason why you Where a great way to start teletherapy is to start with some of your patients that you understand and already know. You know how they react. You know the kind of things that are going to do. And it's easy to transition that same sort of rapport and understanding and in a relationship online. Another thing to keep in mind in a lot of these modalities that we're talking about for autistic kids, for speech and language pathology, are about behavior changes and reprocessing information in new ways. Now, it's great when the therapist is there in the room and is helping correct and change, and we're seeing huge progress, and we're able to check off of our goals list and report that we've made huge progress. But one of the things that is most important in both of those kinds of instances is that how do we transition that to more normal settings? It's not the speech therapist coming in and being the hero. It's transitioning that to the regular setting. Can we have the parents take over and do that kind of thing to sustain it? Obviously, that's what we want. Are they performing the same way in school? Social interactions that an autistic child may be learning are really valuable to understand in the office setting. And maybe that's where we begin the training and those kind of things. But ultimately, we've got to have that happen in the actual home or in the school, in the child's ordinary life. And teletherapy is a great way of being able to be a participant with that. If you're talking about a speech delayed toddler, it's great to be rolling around on the ground with the reinforcement to get those special words being talked and getting that first vocabulary going. But it's even more important to have the parents being the ones that are rolling around on the floor with the right reinforcements, getting that to happen. And it's a great way for the speech and language pathologist to become a coach with the parents to transfer those kind of techniques that can be done all of the time. What I would encourage you is try it, explore it. Begin with patients that you know and that you think would be receptive. Feel out your techniques, see where you're feeling comfortable, and keep exploring into different opportunities. We have many more of those kinds of opportunities that have proven successful listed out on the website. So be sure to visit those tips and tricks and the regular support pages that will help you do that. Good luck.